Our case study is about polycythemia vera.
I had never heard of polycythemia vera until the day that my grandma was diagnosed. She has lived 84 years in a perfect state of health, so when she was sick for over 3 months without explanation, we knew something must have gone wrong.
Polycythemia vera is a slow-growing blood cancer which causes the bone marrow to make too many red blood cells. Your blood gets thicker, causing a slower blood flow, which can then cause blood clots and lead to heart attacks or even a stroke.
The mutation for polycythemia vera occurs on the JAK2 gene. A normal JAK2 gene has an active tyrosine kinase domain, a JAK homology 1, a catalytically inactive pseudokinase domain, a JAK homology 2, an SRC homology domain, and an amino terminal firm.
An image of the JAK2 gene. The V617F mutation occurs in the JH2 domain, and this mutation causes polycythemia vera.
You can use PCR direct sequencing to isolate DNA from whole blood leukocytes. This is the simplest method, although it's not always accurate. The mutation would need to be more significant in the total leukocyte population in order to be detected.
Another way to detect polycythemia vera is amplification refractory mutation screening, or ARMS PCR. Using 4 primers, it can detect a single base change. This is because primers produce specific fragment in the presence of a mutation. This allows discrimination between homozygous and heterozygous individuals with the mutation, and this is the most reliable way to detect this disease.
This disease is usually detected through a general blood test. It will show an increase in your red blood cell count, increased hematocrit, elevated hemoglobin, and very low erythropoietin levels. Erythropoietin is a hormone that stimulates red blood cell production in bone marrow. The normal range for hemoglobin is 12 to 15. When my grandma went into the emergency room after passing out, her hemoglobin was at 17. After this was discovered, her blood was sent in to be tested for mutations, and the JAK2 mutation was discovered. Some symptoms include itchiness, headache, dizziness, weakness, fatigue, blurred vision, shortness of breath, enlarged spleen, unexplained weight loss, numbness, and fevers. My grandma had all of these symptoms for months before she was diagnosed with her disease.
If you are diagnosed, your doctor might recommend phlebotomy to take blood out of your veins and decrease your overall blood volume, or prescribe a medication such as hydroxyurea. This will decrease blood cells by suppressing bone marrow.
My grandma had 2 pints of blood taken out within a month of her diagnosis. Now she's taking hydroxyurea and daily aspirin at small doses to help keep her blood thin. If her hemoglobin goes back up, she'll have to have another phlebotomy, but she is doing great.